Our groups are from Tennessee. If you have a minute, if you will share your name and your city and state, that would be great. We love to know if you're representing a church, which church that is. That always helps us with our getting to know you and with our reporting as well. We'd love to engage with you. If you're able, turn your camera on. We'd love to see your face if you have the opportunity to do that. Also, feel free to unmute during the discussion at the end. We'll have a couple times where we'll open it up with some questions and discussion. In the meantime, if you have any specific questions, you can enter them in the chat. If you have questions that we're unable to answer today, or if we talk about resources during this webinar, we will send out a follow-up email. It'll have links and then reminders as well to sign up for future events. It also contains the link for watching the video back from our YouTube channel if you would like. As such, this presentation will be recorded. And just the other reminder to use the chat for your questions and comments. So we will go ahead and get started. I'm going to actually start for just a few minutes today and tell you a little bit about aging and the reason for this entire project. One thing that we all have in common, if we are alive and breathing, we are aging. There's no real particular age that we assign to being older or an older adult. It really comes down to our ability to um, function and do the things that we enjoy doing. And that is taken as a side by side to our health. And our health includes our physical health, our emotional health, our spiritual health. But most importantly, we want to make sure that we can um, age in place and do the things that we want to do so that we can age successfully. This is just a little video I wanted to show you. It's about 2 minutes long, and I think it sets the stage well today for thinking about aging successfully.
I can't really pick out which was my best days. They were all good. That's it. I'm Mike Newcomer. I was born 1911 and I'm 107 years old.
My name is Patty Newcomer Johnson. This is my home. My dad is Ike Newcomer. And today we feel really fortunate because we're going to have the whole family here.
I'm Dick. I'm 82 years old.
I'm Patty, and I'm 71.
I'm Dave, and I'm 53.
Chris, I'm 43.
My name's Devin. I'm 24 years old.
Tyler, I am 22 years old.
Jonathan, I'm 20 years old.
Knox, my son, is the fifth generation. To be able to say now that he met his great-great-grandfather when he was 107. And not many families can say that.
When I get up in the morning, I say, thank you for another day. Then usually it's a good day.
I look at Ike and I almost think sometimes jealousy. Here's somebody that's 107 years old and everything has come together for him and he's done everything right.
To look at somebody like Ike and know that he worked hard and made a buck at whatever he can do, it's very inspirational.
I can say I retired really in 74.
My gosh, he's been retired longer than he worked. I own a furniture store. Father and I had that furniture store together.
Everybody says, well, why are you working? I like to work.
I enjoy seeing him every day. It is very enjoyable being together.
I guess we were kind of spoiled to have a great grandfather.
Here's a guy that was born the year before the Titanic sank and what he's seen in his lifetime. What are my kids going to see in their lifetime?
If I live to 107, I want to be exactly how he is.
I feel like being given time and growing old is just a way for opportunity to grace itself upon you. And I believe that's something that could actually help to change the outlook on getting old as being grim.
There's actually a future in getting old. And I think that's like a really optimistic way of looking at it that I've never thought about really until this very moment.
I don't really worry about getting older or what am I going to do tomorrow, what am I going to do next week. I just don't worry about it. I'll live for today.
So did you hear the words at the end? Opportunity, optimism, being successful, living for today. Now, obviously, we have to think about our future, and that's one reason that we do this work is really because those of us who are aging into that 65-year and older category, it's really 1 in 5 of us by the year 2030. Our population is growing by leaps and bounds. In 2035, adults will outnumber children for the first time in history. And we say that a lot because there are many implications for caregivers and thinking about how we're going to manage um, our society, our city and county infrastructures to be able to maintain and care for communities which care for older adults. There will be 2 billion older adults, 60 years of age and older by the year 2050. And all of this sounds really far off, but it's really not. In Tennessee, particularly, I know there are some of you from out of state, but for our state in particular, we are seeing a huge amount of immigration. And each dot on this map represents 200 older adults. There are about 7 million people in Tennessee, and 17.3% of those are older adults. And you can see most of the bunching together is in our more urban, bigger cities. In the same way, as you would expect, we see the higher incidence of health issues where we have those larger populations. And this map in particular is shows us the prevalence of Alzheimer's and other cases of dementia for those age 65 and older. So again, we see that same trend with those larger urban areas. And as far as caregivers go, in Tennessee, the typical caregiver is an unpaid female who's non-Hispanic, white, 60 years or older, has a high school education, has an annual income of less than $50,000, is married without children. And this woman cares for her mother full time. In Tennessee, we have over 369,000 caregivers that we know of that take care of someone living with dementia. When someone reaches those moderate to late stages of dementia, we know it takes at least 4 adults to take care of one person well. These 369 caregivers spend close to 5 million hours per year delivering care. That's in addition to caring for children or working at their regular jobs. If you moved that to an equation about salary, it would be worth about $7.8 billion of time these people spend. And if we switch our focus a little bit to health, the 10 chronic conditions that we most see in older adults are really the same as we see in younger adults. The percentages might be a little bit different. But what's important to know is that at least 80% of older adults age 65 and older have one chronic condition. In Tennessee, over 40% have 4 or more chronic conditions. And as you can imagine, that's challenging when it comes to managing our health on a mental, spiritual, and physical level. I mentioned a little bit at the beginning about aging in place, and that's really the ability for a person to live on their own where they want to live, whether that's in a home by themselves or in a home with other family. Perhaps it's in an assisted living or another type of facility, but it's giving them the ability to live where they want to be safely and independently, comfortably, regardless of their age, income, or ability level. Those adults over age 45, 73% of them say that they would like to age in place, whereas 88% of older adults say that they would like to age in place. And so part of the work that we're doing is helping all of us think through and understand how we can best provide that support. Sometimes it doesn't look like a doctor's visit, but it looks like those social determinants of health, which include the ability to get to the doctor or the ability to eat appropriate food, not only to get it through the grocery store to be able to afford it, but also to be able to cook it and fix it. Um, And then just the ability to get around and function independently with doing our bills and shopping and all that good stuff. So this looks a little academic, but I really just wanted to point out that there are two models of care that we work with from a public health perspective. The one on your right is called the 10 Essential Public Health Services, and the blue arrows point to where our work at UT School of Nursing really focuses. And that's on providing some, excuse me, communication, education, and support, and then linking people to the resources in the communities. On the left is an age-friendly ecosystem, and that pulls together lots of different models, and that blue arrow is pointed towards cities, states, and communities. And when you look at an age-friendly community diagram, which is the one on the left, you can see how this faith initiative really blends with all of that. Often we have our faith and religious communities that are working to help people get to where they need to go. They may have buses or transportation groups. They may have some outdoor spaces or buildings. Church, of course, and religious events are big on social participation. There's also that respect and social inclusion. So you can see where we're starting kind of drill down a little bit to the different parts of our communities that are important. On the right is the dementia-friendly community model, and that arrow there just shows communities of faith. And that's where we're just looking to make sure that our infrastructure within our communities is available and set and ready to help support people living with dementia and caregivers, but really it applies to everyone who's aging. So to do this, our job here at UTC is to try and improve community health outcomes by expanding a statewide network of faith and religious organizations, really to impact those health in disparate communities. And we choose to do this because working with faith and religious communities, we know that older adults in Tennessee, over 85% report that their spirituality and faith is important to them. We know that as people develop health needs later in life, they depend on their spiritual beliefs, their values, but also those in their congregations to help provide support for them. And that's really some of the benefit of those faith health initiatives that we've talked a little about all year long. Our congregations are aging too, though, so are our congregational leaders. We can lean on these congregations for the trust that they've established amongst themselves, the trust with community members and other organizations. And then, just like we've seen here in Tennessee with our natural disasters, churches come with a lot of experience. Our religious organizations are used to responding in times of need and disaster. And they also have demonstrated that lifelong commitment to getting that done for us. So part two of this really is connecting. It's connecting with unique partners who offer um, different resources or support mechanisms for our churches and religious institutions. We're going to hear a little bit more about that today. Part of our outcomes include promoting successful aging, decreasing that stigma and fear that's associated with chronic disease diagnoses, also decreasing social isolation and caregiver burden, but really making sure that we're calling out and noting those resources and making sure people have access to those. We, of course, want to build capacity for disaster-ready communities and then increase the amount of people who are aware of and can complete their advanced care planning and legal documents. So just as a summary, those goals are education, identifying resources, and developing a little bit of a network of faith and religious leaders and congregation members so that we can all learn from each other. As such, today, it is my pleasure to introduce you to Becky and Peter Oyer. They are going to talk to you about caregiving, coordination, and faith communities, and really kind of connecting those dots. So pulling all those pieces together that we just talked about. Becky is the owner of Aging Alliance Physical Therapy in Syracuse, New York. She was previously the owner of Inspire Care of Central New York, which was a care management and physical occupational therapy company for 12 years. She's a licensed physical therapist and advanced professional with Aging Life Care Association. She holds a care manager certification through the Academy of Certified Care Managers and is a certified dementia practitioner. Also, she is a certified geriatric care professional. With over 45 years of adult home care experience, Becky is knowledgeable of the challenges facing the aging population and passionate about assisting them to age well. She has volunteered for many church activities, including Bible study and women's retreat leadership roles. Pete, her husband, is the Director of Operations for Aging Alliance Physical Therapy. Prior to that, he served in the same capacity with Inspire Care. His duties include business, policy, and organizational development, human resources, accounting, and marketing. He has over 45 years' experience working in the academic, nonprofit, private, and healthcare settings. Pete has served on multiple church committees, including leadership as a small group facilitator and trustee. They currently attend the Gathering Place in North Syracuse, New York, and they have 4 adult children and 9 grandchildren. Thanks so much, Pete and Becky, for being with us. We are so glad to have you, and we're looking forward to learning more. I wondered if you could just kind of start off and tell us a little bit about what brought you to this point, what your experiences are with older adults and caregivers.
Absolutely. I'm wondering if maybe you could, instead of going through the slides, put us up.
Yep.
We'll talk and then we'll have those slides come up. Christy, thank you so much for that warm introduction. Again, as she said, we have been providing not only professional care, but I would say we've been providing non-professional care with those in our orbit of need in our communities. Inspire Care of Central New York was a care management company, meeting all the needs holistically. We had a strong medical approach in that my background being a physical therapist, I had nurses, social workers, as well as occupational therapists on our provision of care. We coordinated services as a care management company with family caregivers. We worked with home care agencies. Housing was an issue, family dynamics. And we partnered a lot as a professional organization with faith communities. My experience actually as a physical therapist is with a lot of the mobility issues, of course, that go on with aging, as well as the psychosocial, mental health. I've got a lot of training in dementia. My own mom had and was the inspiration for Inspire Care, aged well and into her 80s with Parkinson's disease for 25 years. We find that many, and did as we were navigating through this profession, needed the advocacy and the help of a professional, somebody that had the experience to help guide. Although I find in many companies the medical is not necessary, but I find it has been extremely helpful in our staff and also coming along with the aging population in our immediate area. One thing I want to say is that connecting here as we have is really highlighting to me the nationwide need for touch points of networking, touch points of organization, and also the faith community being part of the solution to aging. Our journey so far, I think right now, the biggest thing is to know that we are not in Syracuse. We are actually doing a nationwide tour with our families. Since selling our practice, we have been able to visit 4 states so that we can see our children and grandchildren. And through that, we have been helping to discern the ministry opportunities of assisting churches. We've been in a listening mode, if you will, to see churches around the communities we've been visiting. What are their programs? What do they have in place? And I think right now, the biggest thing as a private pay company we found is that the caregiving needs are escalating, and informal caregiving and faith communities really need to be a part of that. Pete and I are hoping to help connect those dots in a ministry opportunity.
Thank you, Becky. It's a pleasure to be here. And as we take this journey, as Becky mentioned, as a listening mode, at the same time, I got wind of this wonderful organization called ENCORE Ministry Foundations and Engaging Communities and began listening to some of their wonderful webinars for almost a year. And as we connected with Christy and Stephanie and some of the other staff, we got a real earful of wonderful information and shared what our vision was, and hopeful that we could then answer God's call as we look at caregiving needs. There's so many ministries that are out there, and one of the things we've discovered is that there are many churches that are doing older adult care ministries. There are some that are doing ministries that may not be called outdoor care ministries, but are still serving things like transportation, meal preparation, helping out travel to and from worship. And then we found some churches that were doing a hybrid of both. And we really began as we've been in Colorado Springs, we've been in Rochester, New York now, and we've been in Lancaster, Pennsylvania. And each churches that we've talked to really come at it in a lot of different ways. But we also found some churches that it just wasn't a priority. Either it just wasn't on their radar, and we were able to kind of glean some interest from them as well. So to kickstart, we really looked at, and if you can go to the first slide, please, Christy, really kickstart, what kind of folks are we talking about here? So if we have slide number 1, please.
Yes, sir.
We really wanted to provide you with what we're talking about. So obviously a good definition as we provide our perspective would be useful for you. I'll have Becky read that definition for us.
Caregiving coordination, we feel, is a holistic approach to helping faith communities assist their members in aging well. And typically it's associated in our world with health and physical limitations.
So if we can go to the next slide, please. We just felt that what kind of folks are we talking about? Could be folks requiring medical or health related assistance. Maybe folks who can't attend religious services on a regular basis because their spouse is caregiving for them. Might be folks that require a caregiver, or the caregiver who's a spouse is not able to attend the church service because they're caring for their loved one. Could be folks who are just homebound or live in a skilled nursing or assisted nursing facility. There could even be folks that are near end of life. So as we looked at these kind of individuals that are they're barely inactive and really need assistance, we kept asking ourselves, how could the church help out? So we came up with some components of what we mean by caregiving coordination, and you see that on your slide.
These coordination aspects would involve assessment, which comes through a care plan. Advocacy is so important for each member to have somebody helping them in that journey. Care options, I think so many churches, perhaps pastors who get that first call don't know what the options in their community might entail. Aging in place, Christy nicely spoke about that, versus housing options. Everyone and the majority do want to age in place and stay where they are, but we also know through experience that sometimes that's not the safest nor the best option for them. So helping and knowing where to go to help a member with their housing options. And what are those resources? We never want to reinvent the wheel. We never want to expect a congregation to do everything, and perhaps they're unaware of what the resources in their geographic region are there for and who can they connect with. This is all circling around what we feel is the spiritual support that helps an older individual or an aging individual age well. and their spirituality and the family support is so, so important with that. Every part of what I did as a care manager, I had to know what their financial means were. It was a tough conversation to have, as you can well imagine. These are proud individuals who've worked hard for the money they have, and many don't feel like that's necessary to use those funds for their well-being. So getting a grasp of what their finances are is something that's helpful to know how to direct them. Important papers, I think Christy already mentioned the advanced directives that you were encouraging people to have. That was a big part of what we feel is important. And beyond that, Pete and I developed a program where we had a nice tool where you can put everything together in one spot. How many people have called a pastor, they're in the hospital, and they're asking that pastor, I need this, this, and this. Well, he, of course, or she does not know where those papers are. So that's something that we feel like we can speak into and assist the coordination of. And another caregiving coordination would be church support strategies. I think having a strategy about this, being aware, number one, but then working toward having a process. I must admit, I'm a clinician at heart, a lover of people. Not that my husband isn't, but those strategies and that support and the operations of how do we do it well? How do we be efficient in our needs? And now, how is God directing us to do this well? Is what this caregiving coordination in our mind is all about.
As we've traveled, we realize that there are so many resources out there, in some cases very overwhelming, because there's so many opportunities to get help. And so we saw this divide between the need and then all the resources, and how could we bridge that? How could we connect that in an efficient way that's helpful for churches that are doing so many other great ministries for their folks. And so we came up with some, I guess, and if we go to the next slide, please, came up with some areas that is really important, that we feel is important to understand, to connect those dots. Obviously, we need to understand the need, and we need to know what older adults desire. We need to have an idea of what they want that might go beyond what churches are typically doing already. And that can be a survey, that can be really just moving forward and having a one-on-one conversation with them. There are roadblocks, and we need to recognize those roadblocks. There needs to be an effective process, which what Becky mentioned before. There needs to be a knowledge of all the resources, not only in the community, but the resources that the church may have, not realized. Then in building relationships. So let's kind of dive into those a little bit more and talk about each one.
I think understanding the need comes down to an assessment. There are many tools. We've got great books that are out there that can help churches get an assessment tool in place. We really want to do a demographic assessment of where they live, connecting the dots that way. Are there already older adult ministries in the church, as Pete mentioned? Maybe there is one already for those who need meals or transportation, perhaps to and from church, or even is there a grieving ministry that's in place? We don't want to reinvent it. We want to make sure that those ministry opportunities that are already in place are acknowledged and part of this overall plan. We might even ask the need of streaming. I know right now we're streaming. We all had to get on our computers and connect to Zoom and wonder if the audio was going to work, is the video going to work? Sometimes when a church has a streaming service now, it may not be the easiest thing for that older individual to participate, though it might be the best way because of physical limitations. Someone might need to step in to help them actually go to their house, connect with them, and watch the service together. So I do feel like that there are ways that we can assess the need. I think Pete's going to talk about some of those roadblocks that we have seen to ministry.
One of the things that we discovered as we have been part of the care management company Inspire Care was that in some cases, people don't ask for help, whether it's based on pride or a denial that they even have a problem. And Becky's going to share a story later on about that. That can be a real hurdle if you don't even know the need, and the people that need the need really don't want to receive the need. Obviously, we talked about a lack of resources, whether it's funding, staffing, whatever the local support systems might be in place. And those really need to be addressed and talked about in a prayerful way as to how to address the ministry. Church leadership, maybe not recognizing the need. Maybe it's a matter of all the other things that church leaders have to deal with and not even recognize because people aren't attending for various reasons what the needs might be and how they can be addressed. Maybe it's an inability or difficulty to determine what the care solution might be. Again, that's a lack of perhaps knowledge on what the resources are and what steps to take. And we're going to talk a little bit about that in a couple of minutes. Family dynamics, they can be really an issue, particularly if the family doesn't live in that area. And because we're so mobilized around the country and world, we did have clients that are around the world. It's how to bring the family together in a supportive way. If a family is already part of the worship service of the individual that needs the help, that certainly is a help. But family dynamics can really be a real hurdle. Of course, lack of training. People are interested to help. How is the training going to impact them on a regular basis? And in some cases, it's a long-term commitment. People that have dementia or the last days of their life, and what kind of care can be given over the months and maybe even years that's necessary to help the family. And then perhaps it's an ineffective or non-existing faith community organization or structure that's available or in a process within the church. So again, these roadblocks can really have to be looked at, have to be addressed, but they are real for many churches, whether they're urban churches or rural churches, and how to get beyond the fact of helping care for their loved ones that are members of their church. Effective process, Becky mentioned before, organization and how a church handles that is equally important. We've been to some churches in which when there's a health need, the pastor gets the phone call. And we've heard of experiences where pastors are going one way, but there's a need in another from another member, which they have to go another direction. And again, it becomes very difficult for the leadership. And so understanding that process and who are the key people and who is the point person. It could be a group of understanding the leadership within that church. If a church has elders or deacons or any other service-oriented group or committee, in many cases, it may be just looking at people that really care for their members. They do it under the radar, and they don't even, perhaps the leadership doesn't even know that. But those are the folks that really could help broaden that understanding and that help by understanding that process. Of course, also part of that is really the ongoing commitment that the church must have, looking at their mission statement, their vision statement. Is the ministry going to impact that in a positive way? We certainly could spend a whole time dealing with what the scriptures tell us about helping folks that have needs, particularly the older adults. But again, it has to meet the current vision and ministry of the church. Knowledge and of understanding community resources, I'll have Becky touch on now.
I think it's so important for us to look who are the members that are sitting in the pews that might be part of this church support as people age. You know, in our congregation, we have retired pharmacists, we have retired nurses. So very often, I think it's wise to be on the forefront of asking to see if these individuals would like to participate would like to come on board. And those people resources have a wealth of knowledge from their background in a profession, but now with the need within a congregation, they can really be instrumental in helping to meet that need and empowering them to do so. I already mentioned about the financial resources that people have, but as a church, do we have a benevolence fund that perhaps can be used even to not long-term, but kickstart some of the needs that a congregant might have to begin a new trajectory of aging well? I think sometimes it is a very difficult task to ask people about their finances and connect the dots. Grants like the one that Christy is such a part of has been instrumental in our community in Central New York as well to provide. You know, we do have a lot of local support that the Office for Aging, we have local caregiving resources, we have professionals, much like Inspire Care of Central New York, a advocacy group, a navigator group that can come along and assist members in a congregation. The denominational organizations like ENCORE. I think Pete and I, as we have prayed about our next chapter in life, because we never see the word retirement in the scriptures, we prayed about what shall we do next, Lord, with how you have gifted us in our spiritual gifts, in our professional lives, and ultimately led us outside of the state of New York to find a Tennessee mission that is there in place. We have to know that there are religious denominations that have already a basis, and many of those can be plugged into and help to begin a program or a ministry in churches outside of their geographic area. We have a medical school in our community as well, Upstate Medical. Are there ways in which we can connect? I was wonderfully thrilled and invigorated by the panel that was at the last meeting that I was part of on a virtual aspect to see LeBonner's coordination of medical and faith-based programs. I also believe that there's non-for-profit organizations that we need to tap into, like Age Well in Middle Tennessee. We have Lifespan, which is in the greater Rochester area. I work a lot and have with the Alzheimer's Association, with the Parkinson Foundation. I think those areas, we met with the pastor of the church that we're visiting here locally, who we had a relationship with. He's a young pastor in his late 30s, nearing 40. And he said, honestly to him, he allows the family to take care of the situation if someone came to him. And I wanted, all of us should be aware that sometimes there is a need beyond that. And we're hoping that God's leading us to a way that we can be part of the solution and address that. I do think that there is something that's at the bottom of our list in connecting the dots, but Pete and I would both say could rise to the very top of the list, and that's building relationships. We found that in our professional lives, we needed to build a trusted relationship with those that we were serving. And I know that congregations want to do the same, but it takes a real intentional effort to connect people one-to-one. If you find out about a need in a congregation and you know that there's somebody, perhaps they don't know that person, but that person has the experience, whether it's a life experience, a professional experience, that could address that need. Connecting those two individuals could be instrumental in helping them to age well. I think that sometimes a Bible class or a small group, Pete and I have been members of small groups for years, taking on an older individual from one of those life groups or senior or community groups could actually provide a lot of decrease in loneliness, a lot of connectivity to the congregation at large. Again, we've mentioned retired nurses, sometimes those medication strips and just medication management, even picking up the meds, building a relationship with someone in your congregation with that older senior could be very, very helpful. And I think the last one that I hadn't even thought about, but Pete brought up, is we know how important singing and hymns and music is in the spiritual life of our fellow believers. What if a choir member were to go to someone's church or maybe even a senior living community and sing songs with that individual? It is a key that unlocks a dementia client, can often unlock a life of more mobility for a Parkinson client or patient. So sometimes thinking outside of the box, how do we connect people and build relationships? The most important part, I think, about what we're doing. I think finally, what we would like to do is to say that there are some experiences that we've had that might help you to connect the dots as I'm speaking about these specific situations that had been part of our world. I think that we feel like it can be a success if we can be notified and told that there's a need. The first one comes about from our Together and Caring community of faith, where the pastor himself did not know about the need until it had become a situation where the family member who was in need and her spouse, who was 90, had a daughter 45 minutes away in a very high-ranking professional life. The only way she felt she could get the meals that her parents needed, and there were some specific dietary needs, was for her to drive that distance to prepare the meals nightly. So this woman, who was a principal of a faith-based school, drove back and forth to her parents' home and prepared the meals. Once a congregation member, and these are longstanding members of a congregation who'd not been able to attend, once it was found out that this daughter was driving and the pastor was made aware, he identified to Inspire Care, to myself and one of my nurses in the congregation, the need. We immediately became involved professionally, and we were able to carry through a care plan that would enable the daughter to not only be the daughter, to come and visit, but not have the load of responsibility of caregiving. We went even beyond that. As this woman was diagnosed with stage 4 cancer, she was able to move into a hospice community with our support, and the family felt like their church was a big part of connecting the dots for their loved one. Now, I had another gentleman who was a member of a previous church I attended. I happened upon him when no connection known. I was called into his assisted living facility. And lo and behold, he still had a connection with his old church, but because of dementia, he was unable to really participate in letting them know what he needed. But I found out he was getting regular monthly visits from someone in the congregation, which was wonderful. But I wasn't really sure, as this was a solo senior, no family in the area, no connection, no children, what the congregation member was assisting him with. I gained permission from him to call this man, and I asked him, "What role do you play as a congregation member?" And he said to me, "Honestly, Becky," by this time we were on first name basis because he was desiring to help, but he really didn't know how. Short of a visit monthly, he was not doing anything. We worked together, got more from the church to come and visit, and Inspire Care helped to navigate all the different changes of housing, medical needs this gentleman needed. But at that time, I felt like his spiritual support from his home church was vital. That was story number 2. Number 3 is an ongoing story, because I have to tell you, even though I'm in the profession, I have the background, I have all the training, I have a dear friend right now who is actually early stage dementia, but refusing my assistance. Friends will call me and say, "Becky, she should be calling you because you can help her navigate." But you know what? Pride, lack of understanding of support and what's there. It is one of my biggest challenges now, is to assist her and to make sure that her congregation is aware of her need with her permission and help to see that those needs are met. So I think right now, what we are hoping is that through understanding what we want to do in a ministry and how we're praying to the Lord to guide us and how the Lord has brought us to this spot, to this webinar, that you, through your questions, might be able to help even stimulate us more as to what our next steps would be. Thank you, Christy.
Thank you both so much for sharing about not only your experiences, but about your hearts. And I'm just wondering, I'd really actually like to pose a question to the audience and just ask, what about what Pete and Becky have shared, kind of resonates with you? Does your church already have a care coordination ministry? Are you bridging health and faith somehow? Do you see a need for something different, or perhaps there's not much happening at all, and that's okay too? But just tell us a little bit about where you're at, well, with your church. And make sure you unmute. So I'll get started while we wait for just a second. So I mentioned at the very beginning when we were chatting that my church is a church plant from a much larger church, and we are not far from the college campus. And so we have a huge population of college students, which is wonderful. But part of what has been on my heart is helping connect those students to either smaller churches or other churches that may have needs. They often are willing to help with a move. They're willing to help with yard work. They're willing to help cook meals. There are lots of things that group can do as the church builds an older congregation. The other piece of that is, and especially, as I teach as well, the college students, without fail, every semester I have students who are caring for their parents while trying to go to college. And so being able to help provide some of those connections with resources in the community, I think is helpful. And you would often look at a congregation that has that many young people and say, well, there's not really a place for this there. But I do think there is. And then there's also the piece of prevention as well, for making sure that they're making healthy choices now, so they reduce their risk later. So Karen mentioned in the chat that they have a seniors ministry. Their previous pastor had wanted to revamp the program. So right now they aren't doing much. They're trying to get it back up and running. And then Kim mentioned a legacy group at their church. But other than leader visiting and a few meals, there's no real other structure for needs. And I think that's something that Stephanie and I hear, Becky, as we travel the state, and you mentioned it really as kind of your first point with assessment. I think it's very hard for churches to figure out exactly what that next step is. Can you talk a little bit about, in your experience, how you go about figuring out what the need actually might be?
I agree. I think that assessment, number one, it's making sure that you're aware there is a need. Sometimes it's an awareness. So even just coming before someone just in the congregation and leadership to say, have you looked at the numbers? Even, one or two in our church who are aging need to be identified, need to be assisted. How do we go about assessing their need in a very thoughtful, very respectful way? I think, again, if it's a small church, it could be a one-on-one. It could be going to meet with that person. You get a lot in the person's home. You see a lot. I say I assess without actually having a pad and paper. My eyes are constantly looking at the needs around a home, whether it's the steps they have to navigate, or it's the dishes that are piled up in the sink, or it's opening their refrigerator to get them a drink of water. And I see, oh my, we need to get some help with food. So there is a true assessment tool, and many of them, Dr. Gensler has a wonderful assessment tool. I think there are things that are out there that can be tapped in and made either larger, smaller, depending on the congregation. But it's often a very particular, unique assessment to that individual. You need to know geographically where they are. You need to know as far as their other resources. There are informal caregiving. A lot of families are
Mhm,
there, but perhaps don't know how to help. So
mhm.
I think having an assessment tool that gathers all of that information in a non-binding, non-threatening way is a place to start.
Mhm.
Just a different perspective is, even within our own church, we were praying about whether we were going to do this ministry, and there was an immediate need based on 11th hour health issue. So sometimes, as we've discovered over the years, as much as we want to plan ahead, sometimes it doesn't work. And in many cases,
Right.
it didn't. It's a matter of, we have an immediate crisis, and how am I going to deal with it? And in this case, it may kickstart something more formally because of that crisis, whether it's the leadership spouse that had dementia, that everything was fine, and then all of a sudden, all these problems or challenges were coming due. So as much as we try to plan ahead, it may be reaction to a crisis that occurs within a church family.
Mhm. One of the things you may have heard Dr. Gensler talking about at our most recent event was, um, he addressed pride a little bit, but also, we don't identify as old. Most of us don't, or older or needing services. And I think that it's important from a caregiver perspective, that there are ways that we can minister not just to someone who we see as afflicted with some sort of problem or challenge, but there's opportunity to serve the caregiver as well. And I just wondered if you could talk a little bit about the value of just building that relationship, even if at first they either don't recognize or truly don't feel the need for assistance, but just knowing someone is there can often be a great support for them.
Again, relationship building. I think even to have an ear of somebody that you could call if you're a caregiver, that you could call and just talk about the day. They need a resource that won't critique what they've done. We often feel guilty we don't do enough, and we need somebody that can help undergird with an encouraging ear. So it could just be that. Maybe it's a check-in call, something very, it doesn't demand a lot of the caregiver because often they don't have a lot of time, but they're to check in because you care. So check in at the end of the week. Let's have a check-in call, something very small that might then lead to a relationship of trust, that then a visit could be made, might be able to offer, would you like to go and get a cup of coffee while I stay here with your loved one? I think that the more we can show that we would like to have that caregiver be a son or a daughter again, without the responsibility, and allow us to come along beside you.
Mhm.
It can be very, very small in the beginning, especially if it's a congregate member that has known this individual. There can be pride involved. You don't want to release that our family is in need.
Mhm.
And but again, even having a list of those who are aging in the congregation and begin the process of dividing out so that other people can be on the team of the support.
Mhm.
We have found if we can crack that nut of an individual that we can help, that individual and the people that impact an individual tell other individuals. And
Mhm.
so it's kind of a building block because they are the best advocates because they've received this care and it was done in a very loving and spiritual way. So cracking that nut and opening up, it may take time, but
It might.
we've discovered over the years that that's almost been very fruitful in getting other people to see the need.
And Becky, I'll ask you one last question that's going to play more to your health side, but something I think sometimes I think we make ministry harder than it needs to be. And for all of us, movement is so important. And so have you, as a physical therapist, occupational therapist, I'm thinking about programs that could be part of ministry that are just simply getting out and walking together, establishing walking groups, or even social things, your crochet or things that move your body. Do you want to just say a quick note about that from your perspective?
Absolutely. I was on a webinar this morning about pharmaceuticals and medications. And
Mhm,
we always say in the PT world that movement is the best medication there is.
mhm,
Because really, that's what our bodies need. We need to move. And that means to move our hands, because we might have arthritis. So you're talking about crocheting and knitting, getting in with a group. There's always a social component that I like to tie together with any movement. I think
mhm,
sometimes tying music with movement can be very helpful. Hymns and praise songs. If you go out for a walk with a congregant that needs to be mobile, you could actually have some music playing. They may never have experienced that before. And when you're walking to music, you walk better. You just do. So I do believe that there are ways that a congregation can be aware of movement. They don't have to have a family life center or a gym or have people come to a class. I think it is just an awareness that sitting in a recliner, and I'm in the reclining business because you don't want to have swelling, but a recliner can take us down more than bring us up. So yes, sometimes it's education, Christy. I think
mhm,
even having little blurbs in a publication that goes out to the congregation, here's somebody in our congregation that has a background in therapy. Do you
mhm,
have some specific questions about your loved one? How
mhm,
they could do something simple at home? Then they could connect with somebody. Formal programs, we're YMCA members. We love it. We're seeing a lot of very healthy seniors that are going all the time. Some
mhm,
don't have the means, some don't
mhm.
have the transportation, or that's just overwhelming.
Right, right.
Yeah.
Well, thank you both so much. Any last minute questions from the group? I'm gonna turn it over to Stephanie. And Stephanie's also put email in the chat if you have questions that you want to respond to. And I'm actually gonna share my screen while Stephanie tells you a little bit about what we're planning for next month. Thank you, Pete and Becky, so much.
You.
Good afternoon, everyone. So next month we are going to do a virtual Friendsgiving. And the hope here is that we will have some audience participation by sharing some of your favorite family recipes and or favorite family games that you all use during the holidays. A few components here that we're trying to emphasize are some intergenerational activity, allowing those intergenerational, allowing generations to be together while in the kitchen or playing a game during the holiday season. So we'll compile all of the recipes that we get and share all of them. And then we'll also have it open up so that those on our Zoom would be able to share why family tradition or a story. And then of course some games too. So something that might be easier to play. A favorite in our, for example, a favorite in our family is a Domino's game called Chicken Foot. I am realizing that it might go by other names as well. So we're just hopeful to be able to give some easy ideas for you all to engage with one another over the holiday season. It's supposed to be fun. It's not really supposed to be work related. So don't make this any extra effort. Just send me your recipes, send me your game ideas. We'll share them and we'll compile them all. And who knows, someone might be cooking up your recipe this Thanksgiving or Christmas.
Thank you guys so much. And we'll put this information along with all the links from today's session in a follow-up email. And we look forward to seeing you all next month. Thanks so much for being here. Have a great week.
Thank you.